Hey, Dr. Brian here, and what we're going to talk about today is the 2 things you should be testing and retesting after your workouts or before you do any mobility or recovery work. This is going to help you to dictate and get better at being efficient in your mobility work and seeing are you putting yourself at risk for injury or more injury with these 2 tests. So we're going to do an upper extremity and a lower extremity. Let's go over those now. Alright guys, so for test number 1, this is going to be a 90-90 wall sit with overhead reach. So I'm going to get into a 90-90, so my knees are at 90 degrees, my hips are at 90 degrees, and I'm going to push my low back as flat as I can into the wall. All I'm doing here is simply just bringing my arms with my elbows straight over my head. And all I'm trying to do is touch my back of my hand to that wall. If I can touch the wall with the back of my hand without my low back arching, then you have a good test. If you can't, then you have some type of limitation within the movement, whether it's mobility or strength, of that shoulder girdle. And that's going to be the test to work on overhead positioning. The second test is going to be looking at your hip rotation. This is going to help dictate how well are your hips performing, how well are your lower extremities performing. So for this one, you're going to lay on your back, low back is flat again. One leg at a time, I'm going to keep my leg at a 90-90, so knee at 90, hip at 90. And I'm going to rotate my foot out and rotate my foot in. And all I'm looking at or appreciating is how far can I rotate my my foot out and in without hiking my pelvis. So everything at my pelvis, my hips, my spine should stay nice and relaxed. And I'm looking how far can I go in and out. We're going to look at the right side and then we're going to look at the left side. So you're looking at side to side difference. Before you work out, is there a big difference between side to side? Are you losing range of motion on both sides? And what we're looking for with this test is 35 to 45 degrees of range of motion out. So I should be able to bring my foot out to about at least 35, slightly less than a 45 degree, to be considered normal with in or without foot and in foot on both sides. That's what we're looking for to see and dictate how well are you moving, how well are you improving after you do some type of workout or recovery. So that's going to be your test for your lower extremity with that. Alright guys, so those are the 2 easy tests you can do before and after your workout. And the reason for a test like this before your workout is twofold. Number 1, how prepared are you to move during that workout? If you see that big limitation in your shoulders per se, if there's a big limitation, you do some mobility work, you do some band work, to help to see if you can improve it before you start your workout. If you are getting into your workout and you just jumped right in, you have boot camp, you don't have a lot of time to warm up, then you probably shouldn't go as hard with your shoulder mechanics or with shoulder movements during that workout because you're already at risk because of the asymmetry you have. So it gives you a good idea, whether upper body or lower body, that if you're seeing a big difference or you're seeing over a time a pattern of where you get stiffer and stiffer, then this is a great opportunity to start working on that before it becomes pain or an injury. And the big thing you can do is spend time with your mobility work, again using these tests before you do any type of correction, whether it is foam rolling work, whether it is stretching, whether it is some strengthening or some isolation drills, and you can now see before and after, are you making a difference? So this also makes it more accurate and more efficient to how you're spending time doing that recovery work, that 10 to 15 minutes, 4 to 5 times a week, where you're spending time getting better at the fundamentals, getting better at moving so that you can get the most out of your workouts, the most out of your training, and not setting yourself up for any type of risk of injury, pain, or anything that's going to create any type of problem that's going to keep you away from the things that you love doing. So the great thing about these 2 tests are very quick. You only have to do it 1 or 2 reps just to see the difference, and the more you do it, the more you can understand where your body is. It's going to help you identify what problems you may be having. It's going to help you identify what you need to work on. And the great thing is that this is something you can continue to do on a daily assessment to truly understand, are you ready for working out? Are you making sure that you're moving as well as you possibly can? So I hope that guys gives you a lot of great information. If you have any questions, please let us know. You can message us or you can email us, and we look forward to hearing from you guys if there are questions, and thanks for watching our video.